Hello everyone, welcome to Exploring Healthy Mind with me, Omowale Adebowale. Our topic of discussion for today is a very interesting yet very challenging topic, post-traumatic stress disorder, otherwise known as PTSD. But before we go in to start talking about PTSD, I'd like to take a minute of your time to say thank you to everyone who's liked our video so far, and for those who have subscribed to our channel, I'd like to say thank you. If you do enjoy our topic of discussion, I'd like to encourage you to please like our videos and also to subscribe to our channel so that you can be kept updated when we upload our videos regularly. I also want to encourage you to continue to use the resources on our website, fsfaministries.org. There are plenty of resources there for you that you can use. Our contact number is also available on the website, 0800 00-96241. You can use that phone number to get in touch with us if you need to make a referral or you need to ask for help. In today's session, we are going to be exploring together what is PTSD, what are the signs and symptoms of PTSD, what actually causes post-traumatic stress disorder, how can it be treated, what are the management routine for PTSD, and also where do you go to if you need help for post-traumatic stress disorder. When we talk of post-traumatic stress disorder, otherwise known as PTSD, it is a form of anxiety disorder that results from persistent worries, fears or anxiety due to a challenging, stressful or frightening situation that an individual might have gone through. It can be triggered by different events and experiences in an individual's life. It can be triggered by violent events, by assaults, by other life events such as childbirth for some people, or in extreme cases, witnessing the death of a loved one. People who are repeatedly exposed to traumatic situations such as abuse and assaults, they can be diagnosed with a condition called complex post-traumatic stress disorder. This condition may not develop until several years after the individuals have experienced these traumatic events. And in people who are being diagnosed for complex PTSD, the complex PTSD can be very severe and it can affect the development of such a person if they happen to be a child, if they have been exposed to repeated traumatic events in their early years. Then are the symptoms of PTSD. For most people, symptoms of PTSD usually develop between 4 weeks to a month after they've gone through that traumatic event. While for some people, the symptoms might be delayed for a few months or a few years after they have been exposed to that event. While for some people, they go through periods when symptoms occur less frequently and are subdued, followed by periods when the symptoms appear to get worse or become more noticeable. The symptoms of PTSD, I must let you know, can significantly impact an individual's day-to-day life. They tend to vary between individuals, but generally they can all be grouped under specific categories as we are going to be explaining now. The first category I call the re-experiencing syndrome. This is when individuals vividly relive their traumatic experience without being able to control it. And such reliving can happen in different ways. It could be in the form of flashbacks. It could be in the form of nightmares where every night they go to sleep and they are constantly reliving that experience. For some people, it could be repetitive, vivid and distressing images where they just sit down and then they see that image happening all over again. Whereas it could be for some people in the form of physical sensations like feeling sick, trembling and shaking, pains, sweating. And for individuals having PTSD, some of them do have constant negative thoughts going on through their minds where they tend to ask themselves questions over and over again like, why me? Why did this happen? What did I do to make that thing happen to me? What could I have done that differently? And you can see that when people now start beginning to ask themselves this question, it prevents them from coming to terms with what has happened, and then it makes them start to express feelings of guilt and shame. Before we continue, I'd like to ask you this question, and please feel free to leave your answers in the comments box below. For an individual going through post-traumatic stress disorder, when people around them don't understand what they are going through, and then you get people giving them comments like, come on, get on with it, come on, move on with your life, come on, you should have gotten over that. Do you think it is fair on that individual? Do you think that it is very easy for that person to be able to just suddenly wake up and get over whatever it is that is making them to have these symptoms of PTSD? Please let me know what you think, or perhaps if this has happened to you, please let us know what you feel by leaving your comments in the box below. The second category that we're going to be talking about is called hyperarousal syndrome. This is when the individual going through PTSD, this is when they have a constant feeling of being on edge, where they have constant feeling that looks like anxiety. Such person, they tend not to be able to relax. They tend to be easily startled, where it looks like they are very jumpy. And these feelings of hyperarousal often lead to them becoming very, very irritable. They can start to have sleep problems. They can start to have difficulty concentrating, having angry outbursts for no reason, and other symptoms that you can liken with anxiety disorders. Apart from these two common categories, there are other symptoms of PTSD. Such symptoms include common mental health disorders like anxiety, depression, and phobias, symptoms like self-harming behavior such as drug and alcohol misuse, or in extreme cases you could have individuals cutting themselves. And we can also have physical symptoms such as headaches, migraines, dizziness, stomach upset, chest pain, and some other symptoms. To further elaborate on the causes of PTSD, different experiences and events for different individuals can result in PTSD. Some of the events can include serious accidents, childbirth experiences, sexual and physical assault, exposure to domestic violence or domestic abuse, torture. Research findings show that at least 1 in every 3 persons who have been exposed to traumatic events will go on to develop post-traumatic stress disorder. And the reason for this is not very clear, but some people have been shown to be more at risk of developing PTSD than other people. This category of people include people with past diagnosis of depression, people with past diagnosis of anxiety, and for some people it's a genetic factor where one of their parents have been diagnosed with PTSD. It means that they are also more likely to be diagnosed with PTSD. When then should you be asking for help? First, let me remind you that it is a perfectly normal phenomenon for you to get upset about a distressing situation or experience. But where the problem lies is when you then get upset and you're not able to recover quickly from that upsetting situation. You need to be seeking professional medical help by visiting a GP or your doctor if you're still experiencing the discussed symptoms after about 4 weeks or more of the events taking place. By visiting your doctor, you'll be having a discussion with your doctor about your symptoms. Your doctor will then assess that symptoms that you're presenting before them and make the decision to refer you to an appropriate mental health specialist, where you will be supported with a person-centered treatment. The treatments for PTSD include a combination of both psychological therapy and pharmacological treatments. The psychological therapy are designed to help the individual connect with their feelings in relation to their thoughts and behavior. And this can include therapies such as CBT or cognitive behavioral therapy, or for some people it could be group therapies. And apart from the psychological therapy, we also use pharmacological therapy or medication. So the doctors or your mental health professional might be prescribing you medications such as antidepressants, anxiolytic, or medications to help you with your anxiety. And when do you need to be asking for emergency help? Like I always say, if whatever situation or symptoms that you are experiencing becomes very distressing to the point where you're feeling like you want to take your life or you want to do something to harm yourself, you need to be seeking emergency medical help by either taking yourself to the emergency center or picking up your phone to call a crisis line and Good news, we have also launched our own phone number at Fresh Start for All Ministries, where you can call us for emergency support. So you can ring us on 0800 00 92461. If you're still watching me right now, it means you've stayed up till the end of this session, and I hope you do like what we've discussed today. If this is helpful to you in any way, or you know somebody that might benefit from watching this video, I would like to encourage you to please like this video, subscribe to our channel, share with one person or the other, and stay tuned until next week when we bring you another topic. Bye bye. God bless.